Most of us get anxious over being hospitalized. The sights, the sounds, the discomfort, not to mention the medical bills. It can be overwhelming. Each year, there are more than 40 million Americans faced with these worries. For New York City hospitals, that means over 1 million emergency patients annually, and many are uninsured. Fortunately, the city's healthcare system is helping to ease these worries with innovative new treatment techniques that enhance the level of care patients receive. They also have programs that empower patients to manage their illnesses better. On this special edition of That's So New York, we look at how city hospitals are raising the bar for public health care. I'm here with Alan Aviles, president of the city's Health and Hospitals Corporation. Tell me about some of the programs that these city hospitals are offering that are helping New Yorkers from all walks of life.
We deliver 1/5 of all the babies in the city. So starting from infancy all the way through the end of life, we focus on providing the best possible care. We spend a lot of time providing child care and immunizations, preventive care and early detection of disease, addressing cancer and addressing chronic diseases like hypertension and diabetes. We do all of that, and we do it with state-of-the-art programs.
What are some firsts for the city hospitals when it comes to pioneering programs?
The first cesarean section in the United States occurred at Bellevue Hospital. The first level 1 trauma center was opened at Kings County Hospital. At Jacobi Hospital, surgeons performed the first coronary artery bypass operation in this state. We do a lot of pioneering work in providing care for the elderly, chronic disease management. We were at the forefront of the AIDS epidemic in HIV care, and we are the major healthcare safety net for our city, and particularly for the diverse immigrant populations of our city. One of the things we specialize in is making sure we can communicate with those patients, we understand their cultures and their sensitivities, and that we can render the best possible care for them consistent with their culture.
Thank you so much. It sounds like
Sure.
we are in good hands when it comes to healthcare here in New York City. Some of you know I'm not the biggest fan of working out, but I am serious about staying healthy. Besides toning my muscles and keeping me slim, exercise releases my endorphins, helps keep me smart, not to mention a little bit sweaty. We know why fitness is important. It keeps the weight down, improves stamina, and fights stress. Working out also helps prevent health risks later in life, like cancer and especially heart disease. I'm here with Jerry Siegel. He's the Director of Wellness at the Kings County Hospital, and he is going to tell us how exercise can help keep our heart healthy. Jerry, tell me the importance of a workout routine and how it can actually strengthen your heart.
The heart is a muscle, a specialized kind of muscle. And like all muscles, you need to work those muscles. Training your heart, exercise does that, and it makes the heart more efficient in its functioning. In the heart, of course, we know pumps blood throughout the body.
Yeah.
So a more efficient heart will pump more blood at a slower heart rate.
Why is it important to go to the doctor before you get on the treadmill, before you go for a jog?
Looks can be deceiving, and many people can have congenital problems, things that they were born with, never diagnosed. So it is important, regardless of how you look or how you may feel, and you want to begin an exercise program, it's certainly prudent to go to your doctor and just get a checkup and get cleared.
Can you show me some simple heart-healthy routines that I can do on the go or just, for my busy, hectic schedule?
You want to work the major muscle groups in your body in a rhythmic fashion for at least 5 or 10 minutes. Something you can do in the office, for example. Get up from your desk and simply squat. Squat.
Oh.
Okay, you want to make sure your feet are about shoulder width apart. And you simply, I like to put my hands in front of me just as a counterbalance.
All right, that's not too bad. I can handle that.
Okay, all right.
Thank you so much. As you know, prevention is key when it comes to battling heart disease. Wellness centers at city hospitals offer cardio-friendly workouts that help you to lower the risk of cardiac arrest or a heart attack. City hospitals are also saving the lives of patients through a revolutionary treatment that actually cools the heart. An extraordinary cardiac cooling system is now being employed across 7 New York City Health and Hospitals Corporation facilities. Watch how one heart patient beat the odds thanks to Bellevue's cooling technique.
My name is Naji Salamaj. My husband's name is Joe. We have a beautiful baby girl. She's 2 years, 3 months. It was November 6th, 2008. One of my coworkers sits behind me and he had, like IM'd me. He asked me a question and I hadn't replied back in, let's say, a few minutes or a few seconds.
One of the people that works in the company called me out of the blue, and his only words to me were, Naji just collapsed.
He said he saw me lying face down on the keyboard, and he said I was very blue. And at that point, he started yelling, quote, 911.
I saw Naji on the floor, and they were giving her CPR, doing chest compressions, and she had no pulse.
We are right now standing in the middle of the coronary care unit at Bellevue Hospital. So Najim is a patient who's a wonderful success story. She's a young mom who had a cardiac arrest. The ambulance came, brought her to Bellevue Hospital. When she arrived here, she was very sick. She did have a pulse, but it needed to be supported by multiple medications. A patient who has a cardiac arrest has a very high chance of dying. And if they survive, a very high chance of leaving the hospital, not as they were before.
They told me that this was very serious, that Naji had very, very slim chances of survival. I kept looking towards the positive and said, she's gonna be okay, she just needs time. Naji doesn't smoke, doesn't drink, and she's a vegetarian.
It's very surprising that she had cardiac disease. But sometimes after you give birth to a child, a woman's heart can become weak.
She was still unconscious, and she was just gone. They said that it could just take time, so they said they'd like to initiate this cooling protocol.
Cooling is a technique that we use for patients who have a cardiac arrest when their heart stops. We're cooling the entire body. We want the patient's body and brain to get to a low temperature. When the brain does not get blood, brain cells start to die. When you cool someone, you stop that process. Bellevue started initiating the practice. Even before it became a citywide protocol, we started cooling patients. So we had a good track record from the beginning. We are currently using a technique which uses a catheter to help cool the patient. And this is a tube that we put into the vein in the leg that has 2 balloons that sit in the large vein. We circulate cold saline through those balloons to transfer the cool to the patient's body.
I put pictures of Amelie all over her bed, so if she woke up, the first thing she'd see was Amelie. I wanted her to see her daughter so that she'd know to fight.
It's a tremendous success. I mean, even just saving one patient and seeing them walk out of the hospital is just amazing.
Did you know every October, the city's Take Care New York campaign offers health screening to New Yorkers at city hospitals at little or no cost, including HIV testing, flu shots, smoking cessation, and much more. More information is available on the city's health and hospital page at nyc.gov. So I need to make a tasty dish for a friend's potluck party. She really likes sweets, but the only problem is she's a diabetic. So I've enlisted the help of a nutrition expert, Hazel Thomas, who's gonna show me a tasty dish that's low in carbs, but high in flavor.
Today, we are going to make a peach berry frozen dessert that is low in carbohydrates and it's also low in fat.
Before coming, I was doing some research and I kept seeing this term free foods.
Free food.
What exactly are free foods?
Free foods are foods that have very low in calorie.
Okay.
For example, a salad, like just lettuce, sugar-free products, things like that are considered free foods. Some of the recipes that we offer for our diabetics are choosing foods that are low in carbs, low fat.
Yeah.
And that includes baked chicken, steamed vegetables, and smaller portions of starches.
Okay.
So we are going to combine
8 ounces of, what is it?
low-fat cream cheese, and we're going to do 12 ounces of low-fat peach yogurt.
Okay.
And we are going to mix this
together.
Make sure it's well blended. Now we're going to add light whipped cream. Then we are going to add the berries.
Getting my
So
berries
that we're
mixed
getting
up.
our fruits in there, natural fruits. We're gonna add diced peaches, and let's add some color by adding strawberries. Mix everything up and put it into a 8-inch square container,
Okay.
and then you freeze it, put it into the refrigerator. And here is our peach berry frozen dessert.
Okay. Ooh. This is yummy. I cannot wait to take it to the party. Thank you so much.
You're welcome.
Ms. Thomas is just one of the diabetes educators here at Kings County Hospital. They help patients stay on the right track, offering classes that stress the importance of routine screening, portion control, and proper nutrition. I'm gonna eat all of this like right now.
Thank you.
I was having a family function. I was just eating, drinking potato chips, soda, candy, and I passed out. I was rushed to the hospital where I found out that I was a candidate of sugar diabetes.
Diabetes is epidemic in New York City. It's directly linked to obesity and poor health. Over 700,000 New Yorkers have the disease, and almost a third don't know it.
Diabetes is a disease when the pancreas is not secreting enough insulin or the person is insulin resistant. It affects you from your head to your toe. Blindness, stroke, kidney failure, sexual dysfunction. Once someone is obese, they cannot use the insulin effectively.
My elder sister took me to Kings County Hospital. There they told me I was diabetic, and I started to cry. One of the nurses said, "It's not the end of the world. We'll teach you how to control your diabetes."
The new Kings County Hospital's Diabetes Resource Center is giving diabetics new hope. The 6-week program goes beyond routine glucose screenings and insulin treatments and offers patients a more holistic approach to managing their diabetes.
Banana, orange, or mango. To the dietitian, and she will go over a meal plan. And the meal plan will tell you how much carbohydrate you have at breakfast, lunch, dinner.
We encompass all aspects of what a patient should pay attention to. What is a realistic diet? Exercise, how to take the medications, the different types of insulin.
We have food models, and we have the patients tell us the plate that they eat, and we show them how they can change it into what they should eat.
In the demonstration kitchen, we can demonstrate how to make a meal.
We have the nutritionists cook the food that they know, like instead of fried chicken, we show them how to bake it.
In addition, support groups and nutrition courses empower patients to stay on the right track. A workout room at the center also helps patients stay fit in between class.
I'm exercising, I'm walking, I'm eating right, taking my medicine on a regular, cooking the right food, check my sugar on daily basis. By knowing that I have diabetes, I'm very aware of everything that I'm doing.
If you have the choice, you can control your diabetes. You have a control of the disease. The best way to prevent diabetes is by exercise and meal planning.
Your health is important. If you come to the class, you'll take things more seriously.
Did you know the city's hospital's online diabetes wellness center offers diabetic patients helpful resources, including how-to videos on managing your blood sugar, nutrition, patient testimonials, and tips on taking your insulin. Visit the online center at the city's Health and Hospitals page at nyc.gov. Living with, surviving, or even caring for someone with cancer can be a life-changing event. Sharing your experiences with others comforts those battling or caring for the disease, so they don't have to feel alone. Peer groups are just one way city hospitals support cancer patients. Kings County's Cancer Care Center goes a step further by bringing specialized cancer services under one unit. This makes the treatment more effective and easier on patients.
I'm 47 years of age. I was diagnosed with stage 3 aggressive cancer of the breast. I've just finished chemotherapy. The treatment that I got here, I think it was just top class.
Joanne is one of a handful of new patients at Kings County Hospital's Cancer Care Center. Unlike other medical campuses where patients need to travel from building to building to visit different doctors, the Cancer Care Center brings all the specialists together under one unit, making the treatment process more effective.
We started with the thought of having the patient be the center of what drives us. They have their oncologist, their surgeon, their doctor, their dietitian, their social worker. Everything that they need is here in this one facility, so they can get to know one place is home.
One direct example is if the patients are receiving chemo treatments for the day, if they need to then be seen by their provider on that same day, we can coordinate that.
When you're going through what I'm going through on this journey, you need this sort of environment. It's easy on me as a patient.
Their treatment is not easy. They oftentimes don't feel well after treatment. So as they go through their therapy, they go through their procedures, they know they can come to one place, be treated respectfully, have their questions answered, have their needs taken care of.
The patients love it. They have their own television, their own DVD. Family member could sit with them. They're more private.
In addition, a computer resource center is also available to patients who wish to learn more about their cancer and treatment options.
We have a big outreach to try to get more and more people into screening and in our center for treatment.
They always reach out to you. You are treated like family here.
Hospitals like Kings County are busy places that manage the needs of many patients 24 hours a day. Nurses are constantly on their feet helping those with a variety of needs. If you're an older New Yorker who's ever been hospitalized, you can sometimes feel overlooked when nursing teams are swamped, especially if you're experiencing minor pain, which can be more difficult to detect. The city's hospitals are trying to change that. A new senior-friendly certification program is training nurses to provide age-sensitive care. They learn to communicate better with patients, be ready for risk factors like incontinence or falls, and keep up with the medical regimens that elder patients need.
Lung problem. I came in 2 weeks ago. When I came in, I was in excruciating pain. In the past, I didn't receive good care because you'd be here 2 or 3 hours before you're even seen. Now it's upgraded, so much so that it's a pleasure to come to the hospital. They'll come in and introduce themselves. When they ask you, Miss Robinson, have you eaten today? How do you feel? Are you getting the proper care?
I'm your nurse, all right? I wanted to know how's everything going after your discharge?
So because I'm coming back because my feet swell.
The number of elderly is growing tremendously in this country. Elderly patients have higher healthcare risks. 1/3 of all Medicare patients that are discharged from a hospital are readmitted to a hospital within 30 days. NICH stands for Nurses Involved in Improving Care to Health System Elderly. We have outside experts. They work with our staff nurses and provide special training on issues specifically related to care for patients who are 65 and older.
An elderly person or who belongs to that age range can cover 7.8 days of admission. The goal of the program is to provide a more sensitive care for the geriatric population. Because of the sensitivity of their conditions, we're looking at falls, pressure ulcer, sleep problems, urinary incontinence. The curriculum includes the training of each specific need that is particular to this age range.
Do you have any follow-up appointments or anything else?
No, I didn't have. They gave me prescriptions.
We do a lot of therapeutic communications with these patients, where we're able to give them the compassion and give them the care that they need. The NICH program allowed me to identify risk factors early. Levels of confusion, eating habits, skin breakdowns.
Good. Your lungs sound clear.
Excellent. I didn't expect this good treatment like this. They gave me my medication in time. I was surprised to see a nurse, one come in for give you the insulin, the next one come in and set up your medication, the next one, it wasn't that way before.
I believe that they will have better outcomes if we're able to anticipate the needs that they have, then we're better able to take care of them.
Brian, you are a music therapist here at the Kings County Therapeutic Rehabilitation Program. Tell me about the patients that you work with.
We work with people with diagnosed mental illness. Basically, anyone who has something happening that inhibits them from functioning in a safe way for themselves or other people around them.
Tell me how music therapy helps with their recovery.
With these certain types of illness, verbal therapy can be limiting. There's things that cannot be expressed, if they have trouble communicating. And what happens with the creative arts modalities is we give them another space in which to connect with other people, to express themselves, to feel connected, and to reach therapeutic goals that we talk about with the treatment team.
Tell me about the Recording for Recovery project.
We will pick a topic to talk about. Where would you like to see yourself in 5 years? If you could go back in time and give yourself advice, what would you say? Everyone gets a chance to say their reactions to it, as you can see on the board, and that becomes the chorus. We talk about how should it sound. And then we get onto these instruments, we start making how we want it to sound, and then we take turns sometimes, we sing it. And it really gives them a chance to verbalize what they need to see it, to play it, and to really connect to it and internalize it.
Wonderful. Yeah. Well, I have my instrument. I'm going to sit in on one of those recordings, right?
We would love to have you.
More and more city hospitals are turning to the arts to help patients with psychiatric, substance abuse, and other emotional problems. Art therapy can really give them an outlet to communicate and express their inner angst and just be their creative self. Some patients can even use their talents to earn healthcare credits. One City Hospital in Bushwick has a program where painters, photographers, and actors can provide artistic services to its patients in exchange for doctor checkups and other medical services.
I'm Maggie. What's your name?
I'm a puppeteer. I do puppet shows for children.
What to do?
I usually work here at the daycare. I sing with the kids. I have my puppets. I show them how to use them.
Move your hand around like this, slow, like a spider.
The Artist Access Program is a way for anybody making their living through creative means to offer their talents and their gifts within the hospital community, and in exchange receive health care, ER visits, prescriptions, mental health, physical health, anything within the walls of the hospital.
The Artist Access Program provides a great alternative where I can go and give my artistic self to the hospital and then in return get to use the hospital's facilities.
You're generally in good health? It's based out of Woodhull Medical, but we have several different clinics throughout the community, so artists can perform there and also receive treatment in our clinics.
I had health insurance, but it was expiring, and I needed it pretty badly, and I was looking through a lot of health insurances, and when I heard about Artist Access, I thought that was a great idea.
After I got laid off for a few more months, I saw all the insurance I had, and so this was a godsend, basically.
Physical therapy is one of the programs I'm taking advantage of, and it's working out really well.
I can now come to the doctor when I need to come to the doctor, which is a great relief.
Most artists don't have consistent health insurance. The income is inconsistent, the jobs are inconsistent. So it was a way to cater to them and also have them serve the community that they live in.
We can come to the hospital. You can do whatever your specialty is.
Hi, my name is Enrique Martin. I'm a photographer for the Artist Access Program. I take pictures of newborn babies. I'm really one of the first people that see that baby, aside from the doctors and the nurses. Sometimes even before their own family, I see the baby and I take their pictures for the first time.
It's great to paint holiday decorations and see the looks on people's faces, nurses, doctors, patients. They just light up.
Being able to express yourself and being around something creative is really a very innate way for human beings to feel whole again and to feel that life energy.
Did you know the city's Health and Hospitals Corporations offers affordable public health insurance and sliding scale fee for hospital and doctor visits? Programs include Medicaid and Family and Child Health Plus. To find out more, visit HHC's website at nyc.gov. Patient education and wellness workshops, innovative life-saving technology, and enhanced care for special populations are just a few of the ways city hospitals are changing how they serve their patients. The mission of the city hospitals is to offer affordable, comprehensive health services with care, dignity, and respect. And with over 11 acute care hospital centers, 6 diagnostic treatment centers, and nearly 100 community clinics across the city, our public hospital system has you covered, no matter where you live in the 5 boroughs. You can find information on many of the city's innovative hospital programs, including the ones featured on the show, by calling 311 or visiting the city's website at nyc.gov. I'm Kela Walker for the special edition of That's So New York.